This is LiveWell Talk on Human Trafficking. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Joining me today on the podcast is Albaugh and Marilyn Gerhold, members of the St. Luke's Stop Abuse for Everyone, or SAFE Committee, as well as the Human Trafficking Subcommittee to discuss human trafficking and what we are doing as a team here at UnityPoint to raise awareness and educate the community and hopefully prevent this horrendous crime from happening. Marilyn, welcome.
Thank you.
Thank you.
Human trafficking is real, and Liam Neeson with a peculiar set of skills is not going to show up to save you, right? I mean, this is the real deal, and it's sad, but it's real. But I think a lot of people probably feel, not in this country, not in Iowa, not in Cedar Rapids. You know, this is something that happens in the Middle East or Eastern Europe or something like that. But tell me a little bit about the problem we have locally, as well as just the concept of human trafficking, but what's it mean for people in the community and listeners?
Yeah, it's kind of the hub.
We
have the 380, I-80 intersection. So it's a major transportation vehicle for our traffickers because they can connect those big cities of Minneapolis, St. Louis, Omaha, and Chicago by bringing them through Iowa. And as you said, Dr. Arnold, we in Iowa tend to think that it doesn't happen here in Iowa.
Right.
So it's a perfect place for those traffickers to bring those victims through here. They often hide them out in small towns because, again, it doesn't happen in our small towns when, in fact, it actually does.
And I mean, it can happen. Can it happen to both male and female? And it's not all children. I mean, it just kind of tell me about who does this happen to? Who's at high risk for being trafficked?
Yeah, that's our vulnerable population. Those are, a great number of people that are being trafficked are in foster care. Our youth are extremely vulnerable. They, those who are living in poverty or those who are maybe mentally challenged, whether it's a disability or, there's several. Runaways is another huge one. Our traffickers know who to prey on. They know where to go, where these, especially the youth, are hiding out or are going to, and so they're there to groom them then to become victims. So I think our internet is another place. They know how to find those people who are searching certain places on the internet.
Wow, yeah, the internet's bad. Just bad. I think the anonymity of it, the depth of it.
Right.
There's bad people out there, and they use it as a tool. I mean, you read about the grooming gangs, like in I can't remember the city in England. That had the grooming gang that went on for like a decade. But you read those articles and it's like, these guys were pros. I mean, this was structured to build trust and to get them to draw them in. Right. They didn't just walk up and kidnap them, is what I'm saying. But they got them either addicted to drugs or somehow they built up this relationship and then abused it.
Right.
Is that what happens here too?
Yeah, they're master manipulators. They really are. They know who to look for and stuff. And, we had a local girl. Some of our victims, too, can be victims who are abused at home currently. We had one local girl who was being abused by her mother's boyfriend originally. And at the age of 14, she ran away from a treatment center and was actually picked up by a trafficker down here at the Hy-Vee on First Avenue, was taken to Chicago. And it was an undercover cop that was working in Chicago that ended up bringing her back to Cedar Rapids.
Wow.
So absolutely, they're your master manipulators. They know where to look.
And what do I do? What would lead me as just a community member to suspect that maybe a human trafficking is occurring as I interact with people? What would I see and who should I tell about it?
That is the hardest part, is because your trafficker isn't your guy who drives around a big Cadillac, looks like a pimp, wears the chains and all that. It's your average person. So it's hard to identify who a trafficker would be. In fact, it could be your neighbor. It could be somebody you go to church with. Our advocate with Chains Interrupted said that she had a girl that disclosed to her that her mother was actually trafficking her, but nobody would believe her because her mother was a professor. So it is very hard, but you want to be looking for signs. And Erica will give us some of the signs to look for when you notice it. And I'll let you take that, Erica, because there are some things that, whether it's something they say, a name they might call somebody, it might be an older man with a very young girl. So you want to just be looking for things that are out of the ordinary.
Something that just doesn't feel
Yeah,
right.
yeah.
Erica, tell us about that. What should I be looking for as not only as a physician, because it's the listeners. I know the 600 members of the medical staff all can't wait to listen to my podcast when they come out, so I know they'll be listening. But as far as community members, what would I be looking for?
Looking for certain tattoos. Daddy is a very big one. Also looking for someone that won't make eye contact. If you come across someone and they don't know where they're at, they're not able to talk without the person that's with them answering for them. Be aware of who's with them. If something doesn't feel right, it's probably not right. And don't be afraid to ask a social worker for their advice in certain situations.
I mean, this certainly falls, I'm guessing, under the mandatory reporter duty for us clinicians.
Yeah, actually it doesn't.
Really?
Unless they are a minor. Then we go into mandatory reporting mode. But the person that comes in that might be a victim has to want help. And we can't force them to want that help either. The first thing that we do talk about with the nurses is we need to separate the person from the room, take them into the restroom, get them away from their phone, and away from anybody else that could have brought them into the emergency room. And then at that point, ask them if they need help. If they don't want help, unfortunately, we just reassure them, if you ever do, that we are a safe place and you can come back and we are able to help you.
Hospitals are safe places. Are there other safe places that people could go to? I mean, obviously law enforcement and police stations, etc.
Right. And that's where it gets kind of tricky, because not everybody's educated on human trafficking or what to do. Some of these victims are kind of perceived to be maybe prostitutes, so they're not going to be treated the same. So really, it's hard for them to find people that will help and that understand. I know, and you might have seen it too while traveling in like gas station bathrooms, there are human trafficking hotline numbers in the bathrooms for them to call. So there is definitely people they can call and they can come help them. But unfortunately, because not a lot of people have been trained on human trafficking and what to do, it's really up to the hospitals and the healthcare providers to get this information out. And then we're also working on the community-wide and getting more education out there, so more people are able to assist.
And do we immediately call law enforcement when we suspect this? What do we do?
Okay, so what we say first of all is to let the social worker know, let the charge nurse know, house supervisor know. And then we have what's called a safe binder. And the safe binders are located in every nurse's station in our hospital, including the ER. And in that binder, we have a tab for every kind of abuse you can think of, from elder abuse, child abuse, and human trafficking abuse. In that binder, it's going to give a list of information on what to do, your protocols, your algorithms on what to do.
Okay.
We can call a few places here in Cedar Rapids. We do use Chains Interrupted. Teresa Davidson is the CEO and founder of Chains Interrupted, and they do have safe houses, the Harbor House here in Cedar Rapids, that they open up to survivors to help them get out of the trafficking ring. So we do definitely have our resources. We do have some police officers at the Cedar Rapids Police Department that have been trained as well in human trafficking, so we can call them. But we do have to be really careful of who we contact. So these victims or survivors are treated the way they need to be treated and not seen as a prostitute or something else.
Have we seen, you hear about the illegal immigration and the border and the controversy regarding its openness right now. Have you seen that increase the number of human trafficking? They say it does, but have you seen it?
Right. We don't have very good statistics on human trafficking to know exactly the immigration status of those. Are they out there? Absolutely.
Yeah.
Here in Cedar Rapids, I don't think we really have
not
much,
really identified any as being immigrants.
Because they give indication that the drug cartels, this is like a subsidiary business they have now that makes them billions of dollars a year, is human trafficking.
Yeah, It's guessed to be about 150 billion, actually only second to drug trafficking. They've surpassed the arms and weapons trafficking. And both the Homeland Security and the Department of Health and Human Services says that human trafficking is the fastest growing. So probably will outdo the drug industry at some point.
Yep. Wow. As of right now, labor trafficking is the number one trafficking business. But 80% of it is sex trafficking.
For the money.
For the money.
To the coyote or whatever, to get them across the border. Wow. Yeah. What are you doing to raise awareness? Other than the vast listening audience of this podcast, what are you doing to raise awareness around the community?
We go out quite a bit to do education. In the hospital, we talk to different departments, educate them on the safe binder, what to do, random stops around the ER, kind of given some quizzes so everyone's informed on what to do if they do get a blue dot on a cup, which is one of our processes in the ED.
Right, to signal that.
Yep. And right now we are Marilyn, Samantha White, and Dave Phillips and myself are on the board for the system-wide for UnityPoint Health. And I'll let Marilyn kind of explain a little bit of that.
Well, it's actually a chartered work group that we started earlier this year for human trafficking. And so we're working with people from each of the affiliates throughout UnityPoint. And we've just started that to bring more education out to the hospitals and the clinics. We know that they say that 88% of trafficked victims are seen by a healthcare provider during their captivity, we'll call it that. And the majority of them are seen in an emergency room. So we kind of focus our training on the emergency room, even though we know urgent care and your women's clinics and your outpatient clinics also see those victims. Right now, we're kind of focusing on getting that information to our emergency departments.
Mm-hmm. Interesting. I certainly see the posters, the other information around the hospital, the blue dot. I've seen those instructions too. Did the pandemic influence this? Do we think it increased during the pandemic?
Absolutely, because of no school for the kids. They were all home, and what were they doing at home? They were online. They were using their computer or their Xbox and Fortnite and everything like that. Less resources were available during that time. So we don't know exactly if there was more human trafficking happen because we didn't have a lot reported. But we did see a very large increase of internet pornography. A lot of those pornography sites were giving free subscriptions to people during that time because they knew they could lure them in. So, the pandemic did put a big wrench on our education and being able to identify our victims and helping them.
Yeah, I mean, the old saying, idle hands are tools of the devil. Certainly was true in this circumstance with the kids at home. I hadn't even thought about that, really.
Dr. Arnold, you mentioned something about what we watch for here in the hospital. And we gave you some of those red flags that are obvious, like the tattoos, the no eye contact, that. But I think something that often gets overlooked is our patients that come in under the influence of some kind of substance. Many times we look at them as drug addicts or just on those when, in fact, some of our victims are usually drugged because they can become more submissive that way. So we have to keep in mind that when we have those patients come in, that maybe something more is going on than just them using the substances, that maybe they're being forced to use them.
Yeah, that's a good point, Marilyn. I've always said that to myself, that the alcoholic that comes for medical care, there's something more going on because they wouldn't be here if they didn't have that. And you really have to ask those tough questions to get to the bottom of that. That's a good point.
And often these traffickers get them on drugs so that they can control them more because they need that drug after they're addicted to it. And so they need that trafficker to supply that for them.
Right.
So, we need to look at the bigger picture for all of our patients.
It's kind of invisible chains in a way, isn't it?
Yeah.
That's good advice as clinicians to look for that. And, when you're talking about Marilyn, that we have it here in our community, we have it in the rural setting, easier to hide. I can't remember which Sherlock Holmes story it is, but Holmes corrects Watson that it's not the urban centers that have the heinous crimes. It's actually the rural countryside because there's no witnesses,
Absolutely.
And that not just because it's a pastoral small town, that it's not necessarily free from this evil activity.
Right. And we often look away because we don't want to get involved,
Right.
or we don't think it's happening. Couldn't be that here in Iowa.
Right.
Mm-hmm.
What advice would you give? Let's say someone that's a victim of trafficking is hearing this podcast. What should they do?
I would like them to come to the emergency
Okay.
room. It's a very safe place for them to come to ask to speak with a social worker or somebody in private if they can get away from their trafficker, or put a blue dot if they go and use the blue
Right.
dot program. If they use the restroom, they can put one on that, and then we'll seek them out and try and get them alone, because we can connect them to the resources that we have available in our community to help them get away. So I would say that would be the number one thing I would tell them to help keep them safe, because we have security and stuff that can protect them from that person.
And
advice.
also, if they're not able to get to the emergency room or to another office or healthcare provider, if they do have access to a cell phone, they can text HELP, and that is to 233-733, and that is the human trafficking hotline text messaging, and they can get help through that as well.
What's that number again, Erica?
Text HELP to 233-733.
So January is Human Trafficking Month. There's a month for everything, right?
Yes,
Every,
there is.
National Onion Month or whatever. But so tell us, what does that mean?
It's our month here at St. Luke's to raise awareness of human trafficking in our community. We are going to have the lights outside turn to blue to represent our survivors and victims in our community. We're also going to have tabletop information tents in the cafeteria at all the tables. So people during their lunch, they can read a little bit about human trafficking and signs of human trafficking. We'll also be doing a webinar with Teresa Davidson. That will be a live webinar, and that is on January 26th. There'll be more information on the web, on the hub for that, for sign up.
Okay.
So, and then also we have boxes in the cafeteria and in women's and children's in the social worker office upstairs. We are collecting items for the Harbor House in Cedar Rapids. This is the Chains Interrupted safe house for human trafficking survivors. So they're needing gift cards for food, gas cards. They're needing toiletry,
Paper
that
towels.
kind of
Right.
stuff. So there'll be a list on the hub for that. And then every box will have a list of items that they're needing for those houses as well.
And about what's the capability of is it harbor? Like where
Yep.
you park a boat? Harbor?
Yep,
Okay,
that's- mhm.
harbor. The Harbor House, how many people can it accommodate? How big is it?
Well, they're individual living spaces.
Okay.
There's more than one. We can't really get into too many
That's
details
fine.
of what
No,
they
that's
are.
fine. Just curious.
Yeah.
What's our capacity?
Yeah. As for their capacity, that is also very, very tight sealed. We don't even know
Mhm.
exactly that information. We don't know the locations of them or anything. We just know that the houses are full right now and
Wow.
that they're needing some items.
So these people are not only at risk for retaliation, perhaps from their traffickers,
Mhm.
or their traffickers returning.
Yep. And like the survivor that you guys helped out with the donations for the tattoo removals.
Right.
That person was also at the Harbor House as well. So-
Okay. Yeah. I had actually slipped my mind that we did participate with giving money to tattoo removal.
yeah, that was great.
Yeah, I think you brought up another great thing, Dr. Arnold, and that's just the victim being at risk because of the trafficker. That's something we want to always keep in mind when we're working with victims of human trafficking, because they're not too far away from that trafficker. They're being watched. We're often told that when a patient comes into the hospital that we suspect may be trafficked, that we should turn their phone on to airplane mode, because that way they can't be tracked. We want to be careful about the information we send with them, because if the trafficker sees that they're reaching out for help or sees information, they're likely to get abused because of that. So we want to be really careful. And it's similar to domestic violence, where they say it takes like 7 to 8 times before a person will actually leave a bad situation. It's the same way with our victims of human trafficking. It takes some time for them to be ready to leave that situation for whatever the reason is.
Yeah, I think what you're
Yeah.
just emphasizing, which I think a lot of people understand, is there is a huge psychological component to this. It's not
Absolutely.
all
Big.
physical.
Right.
There's a
Right.
huge psychological, because they groom them.
Yes,
They get them
yes,
so they
yeah.
can control them
And
psychologically.
they make them feel guilty if they're going to leave.
Right.
The loyalty, they play off of that. They've made a relationship with this
Right.
person. So yeah, they play off of all
Right.
of that. They may threaten their family members. So there's a lot of psychological reasons they might not leave a bad situation.
We've heard stories where a girl was afraid to leave because the trafficker threatened her, saying that if you leave, I will go get your little sister and do this to her.
Yeah. Yeah.
So
That earlier I mentioned it in the United Kingdom. It was they will kill your parents if you
Mhm.
say
Right.
anything.
Right.
Which these people are evil enough. That's a legitimate
Yeah.
threat.
And they're
isn't
right
it?
here. We see
Yeah.
that happen. I mean, even in the emergency room, we had a patient that was in there that actually came in, we believed it was substance abuse, but through that assessment and stuff, realized there was a lot more going on. And her trafficker was actually sitting in the waiting area with another person outside watching to see where she would go.
Wow.
So we have to be really on our toes.
I think the take home for me is it can happen to anyone,
mhm.
and it
Mhm.
happens everywhere.
Right.
Yep.
And that's the thing. We just need to be vigilant about that.
Absolutely.
Well, Erica and Marilyn, thank you for joining me today. Again, that was Erica Albaugh and Marilyn Gerhold, members of the St. Luke's Stop Abuse for Everyone Committee, SAFE Committee, and they're part of the Human Trafficking Subcommittee. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.